Hi guys, Dr. Jonathan here from 901 PT to talk to y'all about strains. Strains and bruising make up 90% of muscle injury, so I think it's a common thing and something we all should kind of be familiar with. A good topic to talk about, specifically a strain of the hamstring. Now your hamstring attaches from your bottom butt bone all the way down the side of your back, the back of your thigh to each side of your knee. We break strains down into three categories. The first category, some muscle fibers got torn, not a big deal, very mild case. So you may experience some pain or spasming at the end of your stride. Grade 2 is up to 50% of the muscle fibers have been torn. More moderate, more significant of a tear. This, you're gonna have trouble walking. You're probably, and especially gonna have trouble running as well. You may have a limp, might feel some spasming and swelling and tenderness. There may even be a blood bruise on the back of your thigh. So grade number 3 is the most severe, 50% to a full tear, I can't talk. So of the muscle belly or the tendon. So at this point, that will be pretty significant. You might have trouble standing. But like a tear, it's common to have some bruising show up as well as some swelling. And if you look at the back of your thighs, there might be a noticeable difference in the muscle definition. You might see some abnormality there. So those are some things you want to pay attention to. So strains typically happen with sports. If you're sprinting, if you're stopping and going really quickly, a lot of powerful movements seen in football, soccer, rugby, and runners also sustain them as well. One way we like to check in the clinic, I like the shoe off the foot test to kind of tease it out. This test has a great predictability on what you'll find in an MRI, meaning that if you test positive, there's a chance it'll be positive on an MRI. They might pick it up. If you test negative, there's a good chance that it's not going to show up on the MRI. So it's simple, super easy. What I want you to do, so imagine you have you're suspecting a tear in your right hamstring. So I want you to stand up, stand on the left leg, and try to get that right shoe off without using your hands or any help. So I typically go like this. I like this test because you're activating the hamstring. You have to flare it up a little bit to get the shoe off. Obviously, the easier the grade, the less symptomatic. It'll be like, maybe felt something, not a big deal. The higher the grade, it'll be a lot harder to get that shoe off. Once again, we're here at 901 PT to be a resource for you guys. If you are recovering from a suspected strain and need some guidance, please don't hesitate to reach out.